So Omicron is impacting vaccinated people more than any variant before it, with a higher rate of vaccinated people both testing positive and going to the hospital than ever before. But there's some crucial context playing out right here in our state. And we wanted to discuss this with our State Secretary of Health, Dr. Umair Shah, who joins us this morning. Thank you for your time.
Well, thanks so much for having me this morning. I hope you're well and Happy New Year.
Well, Happy New Year to you, Doctor. So the New York Times just did a deep dive on data from our health department showing what I was just describing, the case and hospitalization rates for unvaccinated people here, still far higher than the rates for vaccinated people. But what is your takeaway overall for people that see this?
Well, look, we've been saying this for a long time. Vaccinations and now boosters is the best way to protect yourself. That is not the only way, right? We want to add in masks and being careful in certain settings, knowing what your status is. For example, if you have sniffles, is it really COVID-19 or something else? So testing becomes really important. But you are right that if you are vaccinated, you are markedly less likely to be hospitalized, have a severe disease, and unfortunately, those who are unvaccinated, even more unlikely to die if you are vaccinated. So vaccines protect you, especially from severe disease. And so we got to get that message out. And we've been saying it for months, but I think folks are sometimes just not really hearing it. And we have to figure out a way to get people to understand that vaccines are your best way to protect yourselves and the ones around you.
There's a mad rush for a test right now with this surge in Omicron cases all over the nation. And, people are wanting to get their kids back to school. They want to get back to work. We're seeing infections all over the place. People want to know if they maybe were exposed or are infected. Those rapid at-home tests are hard to find, but still easier than maybe waiting 3 hours in some cases to get one of the PCR tests. What is your take on the take-home COVID tests? Are they accurate, and should we consider that good to go if we get a negative result there?
Well, always we want to start with what's the context of somebody? Are they with symptoms? If they have symptoms and the test isn't showing exactly what's going on, then you may need to have a second test. But if you don't have symptoms, you've been exposed, and you get that test, and the test shows you a negative result, then you should feel markedly more confident that you are going fine. But what we want to remind everybody is that, the testing constraints are there. And so, as you know, Governor Inslee announced last week that we were going to be purchasing millions of tests, 5.5 million tests for Washingtonians. And in addition to that, we're getting tests out to schools and also obviously to local health jurisdictions and community clinics. But ultimately, these tests are tools. So if you don't have access to a test today, you should not panic. What you should do is say, look, if I've got symptoms, I need to stay away from other people at least for those 5 days. And if I can get a test and it's negative at that 5-day, great. But if I can't get the test, I'm going to stay with 5 days of being away from other people. And then when I go out on day 6, I'm going to be wearing a mask, and it's going to be a good mask. It's going to be an upgraded mask. And guess what? It's going to be tightly fitting and all those things so that I don't expose someone else. So there's some common sense things we want people to know. We're trying to empower people with information so they can make good decisions on their own.
We had President Biden on the air just last hour announcing he is doubling the number of take-home COVID tests. Can you tell us how soon that we'll see some of that here in our state?
Well, as I mentioned with what we're doing at the state, we're already have received, I believe it's 1.5 million, 1.6 million tests that have already come in, but we're getting those out, as I mentioned, to our partners on the ground. But we're also waiting for those additional tests. We've been told from the federal government that the tests that the federal government, which is different than the state purchase, are going to be coming in January. We're waiting for that to happen, and we're excited about that because that's going to help augment what we're doing. And obviously, we want everybody to know, look, we're doing everything we can, but there is a test supply issue here, and we're doing everything we can to get those tests in the hands of Washingtonians as quickly as possible.
How are you planning to do that?
Well, we're partnering with Amazon is one of the companies, and what we're really planning on doing is to have a website that's going to really allow for Washingtonians to be direct ordering those tests, so it'll be direct shipped to them. But in addition, we're working with our partners, so on the ground, if you can't order it or if there's another need, then on the ground our partners will have some of those tests so that they can also get them out to their community members.
You know, we're seeing reports of counterfeit N95 masks, bogus testing sites. What do people need to be aware of when they're, shopping for masks or going to get tested for COVID? Because, I mean, nobody wants to go wait in line and get a bogus result.
Absolutely. So there are a number of things. So as you know, that there is, people are doing, direct ordering from various sites. We ask them to look at the CDC site, which gives information on which masks are really those masks that you should be looking for. There are certain things that we have on our DOH website, that Department of Health website, that also you can look at. The key message is that if it doesn't look right, it probably isn't right. That's the one thing. If you get something incredibly, underpriced, it's probably there's something going on there. Number two is that when it comes to these tests, we're also looking at what's happening across the system. So when you go to, for example, your local health department that's doing, or a healthcare system that's doing testing, those are probably the most reliable, because you know that they are backed up by that governmental or that healthcare system. When you start to go to some you're not sure, you never heard of, that's when you start to ask questions.
Okay, so looking big picture here, we have heard from your staff and many others that a lot of people are going to be infected by this variant. Is the hope overall, and I hope I use that loosely, is the hope that that is the case? A lot of people do get infected, a lot more people are vaccinated, immunity builds up, and we can finally, hopefully, be done with this thing once and for all-ish?
Well, I would, if you can imagine, you're talking to a doc here, and you're talking to, a public health professional. So I'm going to tell you that I'm going to say get vaccinated. That's the way to get the protection, not by getting infected. And so get vaccinated. That gives you a longer term, a broader, and a more reliable protection. If you get what we call sometimes natural immunity, if you get that, it's going to be narrower, it's going to be shorter, and it's unpredictable. So that's not the way to go. But I will say the hope is that when we get people vaccinated, not just in Washington, around the country, but around the globe, that's when we start to say, hey, we need to move forward with life beyond COVID-19. In the meantime, and this is key, Bill, in the meantime, we've got to also be empowering people with good information and what they can do, the good tools that they can use, so that we can also live with COVID in the meantime. Because we can't wait till all that happens. We've got to also be talking about today. So I'm optimistic for the future, but we got to have some, unfortunately, we're going to have some pain over the next several weeks or even longer until we get past this Omicron variant.
Well, speaking of good information, we always appreciate your time coming on and chatting with us. Dr. Umair Shah, thanks again.
Thank you, and we'll do it again.
All right, and we'll be right back with more after this.